Hi, good evening to all of you watching live. We are streaming this live in the MMA Facebook group for doctors, as well as the DOPS Facebook group for doctors. And with me today is Dr. Vijay, who is the MMA SCOMOS chairman, and Dr. Ashok Philip, who is a past president of the MMA and a member of the MMA Exco. And what we are talking today is a very hot topic, which is bullying amongst the medical profession, and what can we do about it. So this is as a chat amongst us as doctors, and we are broadcasting this only to close the doctors' Facebook group. So we hope that people can be a bit more open about it. And the reason why I decided to try to organize this online sort of chat session is because of recent publicity, and this came out in the papers on in the NST and Consumers Association highlighted this problem, which it's been going on for decades, and they urge the Health Ministry, MMC, MMA to take action immediately, I think, and also urging doctors to make use of the 24-hour hotline. And they quoted statistics which, based on survey in DOBS, that's about 2 years ago already, where we found that about 3/4 of doctors actually had experienced bullying to the extent that it affected their work and their mental well-being. And also more recently, there was also an MMA survey which found about the same percentage as well. So I think it's quite timely. We maybe we had a chat about it, and we can source out any ideas of what we could do about this endemic problem in the medical community. So the to Dr. Vijay and Dr. Ashok. Maybe start with you, Vijay. What is your impression about bullying? What constitutes bullying, do you think, and how prevalent in your experience it is amongst particularly the junior doctors in service?
Okay. Thanks, Dr. Len, and hi to Dr. Ashok. I thank you for the question. You mentioned about what constitutes bullying and what's the prevalence. Now, I'll just tell you a bit about the study that we actually did in 2018. This study was actually initiated by myself. Now, bullying, we often think that actually bullying does not really occur much amongst doctors, because doctors are probably the elite team that are probably who probably best understand one another. Sorry, but if we looked at our study that we did, we found out that about 53% of the bullying actually occurs amongst doctors itself, and the figures were surely more between the ages of 25 to 34, and between the ages of 36 to 45 years old. But saying that, there was still also a small percentage of 7% which did report bullying among specialists as well. Now, in terms of bullying, if we look at the definition of bullying, it's a very long definition, and we in Malaysia do not really have a compiled definition, but this was actually taken from NHS. It means persistent, offensive, abusive, intimidating, malicious, or insulting behavior. But what's important to see is it may be very difficult to understand all the first few words that I mentioned, but I think what we need to understand is what we do makes the recipient feel upset, threatened, and also humiliated. So I think this is something that has to be given attention to. At the same time, I feel there's also a border between strong management and bullying, because a lot of the times when we speak about bullying, especially amongst the doctors itself, bullying could occur at any workplace, for example, among specialists and house officers. So the question is whether was it strong management or whether was it bullying. I think it very much has to take into account the recipient itself, and maybe we could look into four things that can be given attention, in the sense of, are the comments, requests given by the specialist or by the senior, are they constructive, and also are they fair? The second thing would be, are they aimed to actually target and look for a mistake, or is it for teaching purposes? For example, is there positive development behind the criticism? And the last part would be, are the feelings of these individuals taken into consideration when these comments are made? So I think we need to look into these matters to actually differentiate bullying and strong management, which is still a very gray area, I would say. Maybe Dr. Ashok could give his comments on this as well. But I think if you ask me what constitutes bullying, that is probably the best definition of bullying found in given by NHS websites. And at the same time, I think we need to take into account how the recipient feels at the end of the day.
Yeah.
Yeah,
Your thoughts,
I think Vijay has given a very important point there, which is what is the intention behind what is perceived as what might be perceived as bullying behavior. Because we have to remember, as doctors, whether you're a houseman or a junior MO, senior MO specialist, you are in charge of patients, and your knowledge, your actions, your attitudes are going to affect patients' lives. They may kill them. So definitely there's going to be a time when you make a mistake and your boss or your immediate superior has to tell you off. But the intention behind this is what's important. I was mentioning earlier to Alan that if I tell you something and say, look, this is a mistake you made, this is why you made it, this is how you avoid it in future, this is how you correct it, that's fine. But if I go and start saying, look, you're an idiot, how could anyone make this sort of mistake? Nobody could do this, you can't, which college did you pass out from? That sort of thing. So the intention and the way you deliver it is very important. If the intention is to belittle and humiliate the person who you're talking to, then it's clearly bullying. And if the intention is to point out mistakes, to teach what mistakes have been made and to teach you how to avoid them, then even if it's delivered in a bit of an angry tone, then it will be more like what you call strong management. But when you say we must also look at the feelings of the person who's the recipient of this criticism, that's a bit difficult, because of course nowadays we all feel that the young people are snowflakes. So maybe some people can take what is being directed at them, and some people will think any criticism is bullying. So I know that MMA has a hotline for doctors who feel they're being bullied, Help Doc. So when you receive that sort of thing, then obviously you have to investigate a bit further, see whether it was deliberately done to belittle. That is the thing. Is it deliberately done to belittle the feelings of the person? I personally feel that if you criticize someone with the intention of improving them in the future, that is acceptable, even if you do it in a bit of an angry tone. But perhaps you shouldn't do it in front of the patient, because once you do it in front of the patient, you're destroying the patient's trust in the doctor. So this sort of thing, even the environment in which you deliver it is important, not just the way in which you deliver it and the intention with which you deliver it. And another factor is, I think, how fair it is. If you make a mistake, you get told off like this. But if somebody else makes a mistake and doesn't get told off, then you feel, I'm being singled out. So there must be also justice, even-handedness. So the environment in which it is delivered and the way in which it's delivered and the intention with which it's delivered, that's what makes bullying.
To me, I feel the intention is also important, but the manner in which it is delivered, whether it's with vulgar words, very, very harsh words, or even directed at one's gender, race, or medical background, training, or whatever. Sometimes it can be something very insulting, and of course the worst one would be if there's actually physical thing, like grabbing one's thigh, or that sort of thing would be very clear-cut abusive action. But I think in the high-stress medical environment where the consultants are trying to make sure patient safety is at the utmost, and you're dealing with maybe junior doctors of varying standards, and it can be quite exasperating when we face with very let's put it this way, not so well trained junior doctors, and maybe that could be a bit of a tipping point, but still, there's no excuse. I think it's even in a modern age. I think we just have to learn how to dish out this teaching or disciplinary in a civil fashion. I think not. There's no role for abusive behavior.
Oh, definitely.
Yeah.
I mean, when you've got a physical abuse, it's very easy to see. But when it's verbal, emotional, that's much more subjective, I think.
There's some comments coming in now from Facebook. If you can please allow StreamYard to see your name, then we'll know who it is, because we can't see, otherwise we just see Facebook user. So we need to be able to identify repeated bullying behaviors to ensure that it is nipped early.
Yeah, I
think that's a given. Yeah, but the thing is this: how can it be dealt with, Vijay? I mean, in the government setting particularly. Yeah.
Okay. As we spoke earlier, I think the largest amount of those who are bullied mainly come from the house officers and also the medical officers. Now, in any government setting, whether you are in a clinic kesihatan or whether you're in a tertiary hospital, now you do have your immediate supervisors. For example, if you're in tertiary hospital, every department would actually have a specialist in charge of the house officers, and also a specialist in charge that will be dealing with the medical officers and all that. So the first step would actually be to approach them, because these are the people who are actually sort of trained peers who are actually supposed to be in charge of these house officers or medical officers. Now, failing that, you do go up to your head of department, which is in whichever posting you are. You can actually approach your head of department, and failing that, you also have your hospital director, which you can actually complain to. So now in the government service, they actually have a proper scheme in which you can make complaints and you can speak to people. Now, the big question becomes is when people would ask, what are my implications? I'm going to go and see the hospital director. I'm going to go and see the HOD. So will I get extended? Will I get implicated based on this? Would I be targeted after this? Now, these are frequent questions that are actually questioned in the government service, if you ask me. So I think this fear is possibly one of the main reasons that people actually don't reach out. And number two would be, sometimes I think the ones in government service are also taxed with their workload, so much so we fail to realize whether we are actually confused whether we are actually being bullied or not. As friends, yes, we do have warning signs that we may want to pick up. For example, there may be like a drastic reduction in performance levels. Sometimes people taking MCs, change in attitude and personality, and also certain mood swings. Now, these are things that we may be able to pick up as friends. But for the person who's being bullied, if you ask me what to do, there may be a confusion between the self-worth of that person itself. For example, let's say I'm being criticized in the ward that I'm not good enough or I cannot perform up to the thing. So the question that the recipient would actually be asking themselves would be, am I really not that good? Or they'll be confused whether they're being bullied or they're really not that good. So this will be another issue to be tackled. So I think what is also important in terms of this is not only for government service, even for the private. I think we as practitioners, we need to recognize what is happening to us. We need to actually feel strong enough to take action, and we need to be able to understand what action to take. What action to take, as mentioned earlier, there's always a hierarchy where you can actually approach your department or your HOD or the hospital director. And failing all of that, we mentioned earlier regarding HelpDoc. Now, HelpDoc is something which is a Malaysian Medical Association generated effort for those who find it difficult or who need to probably speak to someone outside the government service. Now we have the numbers that they can call, or even the email address. I think the number is being put up on the slide right now. And for the email address, it's actually quite straightforward. It's helpdoc@mma.org.my. Now, we have given the assurance that on HelpDoc, all this information that is actually given to us or any information discussed will be kept private and confidential. So we need people to speak to us if they're having any problems. I think the fear of facing implications is still there, but rest assured, with HelpDoc, we have actually settled a lot of cases, some within, actually most of them within 2 weeks itself. Of course, we do face some cases like asking for transfers and all that, which is sometimes beyond what we can do. But I think in terms of legit cases, we have actually been able to help quite a lot of them via HelpDoc. And recently, we have been actually receiving a lot of complaints, not only from doctors, but also their parents asking us for advice. So I think that's a positive outcome to look at. But at the same time, I think people need to realize that help is available. They can either use the method I mentioned earlier through the government hospital. They can use HelpDoc, or there's also a system which is created by Kementerian Kesihatan Malaysia, which is SISPA, capital SIS, capital P, capital A, capital A. They can actually log into that, and there is actually a portal to actually launch a proper complaint which goes through the hospital management committee. And this complaint will actually be taken up by the hospital committee and be brought up, and the case will actually be discussed with the relevant departments. So these are three methods that are actually already running in Malaysia, especially for government doctors.
What do you think is the uptake of this? What the fears are? Actually, I would can imagine the biggest fear is the person would fear retribution or being picked on by. What if the person bullying is the head of department? What can he do? Yeah.
Okay. If the person bullying is the head of department, like I mentioned earlier, the process is the same. If it's the head of department, then you go on to the hospital director. And actually, the system created by Kementerian Kesihatan Malaysia, which is also on SISPA, is, I must say, actually quite good, because I have personally seen action being taken within 2 days. So this is something in which because there will be a independent committee looking into this matter, and action has been taken quite fast. So I think that is actually a very good pathway that they can actually complain. And at the same point of time, like I said, NGOs like Malaysian Medical Association. So even though the head of department does such a thing, this action can be taken. Now, many may also ask, just to add on, many may also ask, what about social media? What about going to social media and Facebook and all that? Now, I just want to comment slightly on that. I won't touch too much on social media and all that. But I think a lot of complaints that go on to social media does not translate into results. And a lot of times it's perceived wrongly by the public who's reading it. And at the same time, it can actually have a negative feedback on our doctors as well. So I think one should not rush and go into social media complaints and all that, because you sometimes attract the wrong kind of attention. And when you attract the wrong kind of attention, you see, doctors are a particular community which I think are very well looked up on upon. And you don't want to give the public a wrong impression on doctors personally. And it only constitutes a complaint from one side of the story. It does not constitute a complaint on both sides. So I think putting a complaint on Facebook is probably not the best method. Instead, when there are proper channels to look at, I think one should actually follow these proper channels.
So let's say Dr. Harris is again brought out the subject of definition. How did you define bullying in a medical sense? Any channel to have correctional action, I guess, to those in inverted commas dangerous HOs and MOs.
Good question, isn't it? But I think perhaps Dr. Harris wasn't there a bit earlier. There's no real medical sense of bullying, because, like we said, we're in a high stress, high stakes environment. People can die if you make a mistake. So definitely correction has to be done, but it's the intention with which it's done. It's if it is to correct, if it is to put right a mistake, that's acceptable. If it is to belittle the person who made the mistake, then That's wrong. And like Dr. Alante was saying, it's the words that are used as well. If you're going to use words which belittle the person, his race, his religion, the gender, then again, that's a mistake. It's not the way to do it. You have to, there are clear-cut lines beyond which it's bullying. You insult the person's race, religion, gender, if you are intending to put the person down rather than to correct them. But there are also gray areas. So that is where what Vijay has mentioned about CISPA and about help doctors, where we can get people involved, who can interview both sides, try to get a more objective view of what has happened, and also interview witnesses. It's not always clear what has happened, but it is clear that you must always investigate. It's not right for us to say, look, we were bullied and look, we're all right now. So what's wrong with you sissies? That's not the way to do it.
One of the
Yes, Dr. Len, sorry.
No, just to add on this, how do you get best correctional behavior to so-called, weaker MOs or HOs? I think one of the managerial tactics which I learned through experience is, when you want to discipline people, the key thing is to praise them in public, but to scold them in private. So actually one of the most maybe humiliating things for HOs and MOs is to be really scolded or getting a really bashing in front of patients or their family. So that could be quite a humiliating experience for them. I think those in more senior standing should be mindful of what we say to your juniors in front of the patient, because the junior still has to face the patient again, and if you have been really receive a shellacking, maybe the shellacking may have been better in private, where it's not so bad in front of the patient. I think it's one of those things. Sometimes we just, in that moment, the heat of the moment, well, words may fly, but I think we still should be mindful. And I think it's one of the ways to prevent that abusive behavior, which is quite prevalent in our medical culture. Harris also asked, why 20 years ago there is no such complaint when I was a HO, MO, and why only now?
I think Harris has been very fortunate, because I was just going to say, we say, well, we were bullied, but we survived. Look at us now, we're all right. Bullying is nothing. But we are the survivors. When I was a houseman, there was another fellow houseman of mine who took his own life in a very gruesome way. So don't say that bullying has no consequences, that it didn't happen 30 years ago. It happened, and some people died. We have far more housemen now. Now, those days, we were really motivated because it was so difficult to get into medical school. Only people who really wanted to do medicine did medicine. Now, there are people who are not really interested in medicine who have become housemen. So it depends a lot. You start belittling them and pushing them, they'll just, best course is probably they just leave medicine. They may actually take their own lives. So
I think recently there was a house officer who was found suicide, or we don't know. But anyway, the issue about what was I going to say? No, never mind. Carry on.
All right. I was just going to ask Vijay, this CISPA, you have to log in and all that. So obviously there's no confidentiality, but what safeguards are there then for the person who complains that he won't be victimized in the future?
Okay. During the investigation process, the committee elected by the hospital would actually call up each party, and I've really seen investigation, and this has actually happened to an own friend as well, in which the information of the complainant, the information of the information of both sides are not revealed to each other. the information of both sides are really not revealed to each other, and you would actually not even know who complained against you. Now, this happened. The last I heard about this was a true scenario in which this happened during the COVID pandemic, where A complained about B. So B was investigated, but B had no idea who complained, and this was kept confidential even until now. In fact, we still don't know who actually complained. So, in terms of confidentiality, the committee is duty bound to actually keep that confidentiality, and until the case is closed, the case file is kept confidential, and the report goes directly only to the hospital director, and that is submitted to KKM, in which it's either to take action or to close the case. That is about it. So otherwise, there's no information regarding the complainant given out at all. And there will be a feedback given to the complainant, in which is a general feedback, which only the complainant will receive and see it. It's up to the complainant whether they want to share it or not. That's up to them, but only they will be allowed to see it. So it's very confidential, and I think it's one of the other ways that they can actually use to launch a complaint on CISPA. Yes.
So there's a comment also that sometimes all that is needed for someone to take the bully aside and have a word to correct the behavior. I think some form of an anonymous reporting platform, perhaps through CISPA, and then a peer or some representative would be able to approach the alleged bully and then tell the person about the what has been reported against him or her, and but as long as there is no retribution against the complainant, who should be anonymous. Before we started, I was telling you, my hospital, we have something called a Speak Up program, which is anonymous also, based on the Vanderbilt system. So it's pretty similar, except the difference is actually there's no feedback given to the complainant. That's all. There's a channel given, and then a trained peer approaches the person who is complained against, and then the person is counseled that okay, you've done this, you have been abusive in your words, etc., whatever. We hope you won't do it again, but for now it's just a warning, and then that's it. But there's no action will be taken unless it's a repeat offender, and we say please do not try to trace who the complainant is, because the whole purpose is to keep this anonymity. So I think there is some fairness to the person if it's a first offender, but there will be maybe some other form of action taken if it's a repeat offender. So that would be something. But basically, I mean, even the person who's bullying needs counseling as well. I think that's the whole idea. And Haris has one more. Saying, so there are so many who don't have interest in medicine and end up in medicine. So the root cause should be a selection of medical candidate. Ashok, do you agree?
Oh, yes, that is very true. I mean, for years and years, we've been telling the ministry that, you have to have some sort of pre-admission screening. And certainly universities like UN and USM and all that, they do that. But the people who go overseas may go to places where they don't have pre-admission screening. So that's a topic for a whole another discussion. But you got them now. They have spent 5-6 years of their life and God knows how much money becoming doctors. So you can't really. You have to deal with what you got.
But to some, I mean, clinical medicine may be a shock because their idea of medicine may be what they see on television and maybe more glamorous. Yeah, exactly. And then when they are actually thrown in the wards, and it's different from teaching in medical school. The reality of medical practice, which I think is not the same as 20 years, 30 years ago. So I think medicine is much more complex, much more demanding. Standards are higher. You don't accept that.
Patients are more demanding.
Yeah, patients require. Stage 4 cancer demands to be cured. 70 years old dying is no longer sakit tua.
Yeah,
So
no.
people want to live forever. We got 90-year-old, we want everything done, sort of thing. But
Yeah.
so that's the scenario the junior doctors are working in as well. So it's actually tough both ends. So
But
it's
your the previous comment about bully should be taken aside and given a talking to, and that could nip the problem in the bud. It's very true. But you also got departments where the whole atmosphere is toxic, because it starts at the top and every level down takes its cue from the level above. So the whole department becomes toxic, and that is when you need systemic intervention. Sure, that's why where CISPA and Help Doc and all come in. But if you've got a good boss who sees this and takes a fellow aside and says, "This is not acceptable. This is not how you do it," then you won't have a problem. It's only
What
when that
about
fails that
mentor mentee sort of like a buddy senior pairing for all junior doctors coming to service? Is that something which is available now, Vijay? Like,
Okay. In the government service, there's some hospitals practice and some hospitals don't. There's no official how to say system that says you must have a mentor and mentee, but generally that is how we work in the government system. Now the problem comes when numbers increase. You see, when numbers increase, as Dr. Ashok mentioned earlier as well. See, those days when we used to work, we had very few numbers. Everyone knew each other. Everyone looked out for each other. Today, you sometimes don't even know who's in your department, and you don't even know your colleague. And everyone wants to look out. I think over time, the perception of being a doctor is finishing my job and completing my tasks. That system has changed over time. We mentioned earlier that the interest in medicine is something which is really, really important, which has to be looked into. And that has, I think, taken an impact on doctors. And yes, you can have the mentor-mentee system. I think it is a good system, but I think it's also a good system to probably have closed-door meetings in which is being practiced by some hospitals where the director or the head of department speaks to their department doctors regarding this, and it's actually isolated between house officers and medical officers where you can speak up openly. Saying that there are departments where the bullying starts from top, like you had mentioned. So in these departments it will not take effect. So the other thing we can look into is probably communication skills between one another, and this should start at the top if you ask me, because communication skills may not really, yes, it's important for those who are juniors and all that, but if we start at the top and that nature is actually brought down to every single generation or every single step of specialty that is taken, I think that would probably help quite a bit in terms of communication amongst seniors and juniors. Yep. And of course, we saw some comments and all that about what happened 20 years ago and what's happening now. I think one of the other things that we should probably think of dropping is phrases like, during my time. During my time, this happened. During my time, that. I think that during my time is one of the biggest hurdles that probably a lot of people should stop using, because during those days you probably would not do a PET scan, or you may not do you may not go as far as what is being done today. And you all mentioned earlier that even for all stages of cancer, we're looking at treatment these days. So probably it wasn't done those days. So I think we need to take into account all of this. So if you're going to waste time looking at how things were those days and comparing it with these days, I think we are not going to actually nurture our juniors and our doctors. These are the doctors that are going to be treating us in time to come. One day we are all actually going to fall ill. We are all going to be old. There's no way of us escaping this. So if we don't train our juniors to take care of us, at the end of the day, we need to understand that it's sort of a symbiosis relationship actually, where you train them, you share with them what you know, and that's the way you will be treated when you grow older. And it's just a cycle there. So we learn loads of cycles in medicine, that cycle, whatever cycle, but we need to apply this into our daily work as well, actually.
I agree 100%. Agree 100%. Especially as some of us are reaching the older age.
Yes, we are.
Yeah.
But what Vijay was saying about, that phrase, in my day, is also, people who say that often think that how it was done those days was good. Look how I turned out. But in fact, you might not have turned out that good, You might think you're great, but you could have turned out better if things had been done in a more sensitive or less abusive fashion. Just because you survived to now doesn't mean that this is the best that could have been done. And it doesn't mean that what was done before and didn't kill you. I don't believe in that if it doesn't kill you, it makes you stronger. It doesn't. If it doesn't kill you, it can scar you. So let us remember that just because it happened 30 years ago and we survived doesn't mean that it should continue to go on now. If it was like that, then we would probably still have slavery and racial discrimination and religious wars and all that. So all that is old is not gold. You have to change.
Yeah. Well, I think, But do you think younger people now have thinner skin than the old back in the day? Generally speaking, I don't like to be. I mean, I want to be a devil's advocate here because people do talk about the newer generation to being a little bit maybe softer.
Well, I don't know. Let's ask the younger person first.
Anybody want to comment? Am I being unfair to say if any young MO is watching this? Say back in the day we were a lot tougher, and you youngsters are no longer so tough and can't take criticism. Is this fair to say that?
I think there are a few factors here that I like to say. Yes, we do see this happening quite often, but we also need to take into account a lot of other factors. For example, I did mention something about cyberbullying earlier and also social media. You see, when one shares these kind of stories or these happenings, it automatically affects our simple phone or our iPad affects our life a lot. So this is something that was probably not available last time, but it's available today. And this kind of information is easily shared. And if you ask me, someone may put, I'm being bullied, and the person who's reading it might think the same. Similarly, I'm also being bullied. And this becomes like a cycle in which everyone says they're being bullied. But the question is, are they really being bullied? The definition is of bullying, even if you ask me, although I can define bullying by definition, but if you ask me really whether I'm being bullied or not, sometimes I really cannot define. That's number one. So I feel social media plays a huge role in that. And number two is the numbers, like we mentioned earlier. Thirdly, I would say, like was mentioned earlier also, regarding the interest in medicine. You see, those days when there were very, very few medical schools, I think we have about 33 currently in locally itself that are producing medical graduates, 33 or 34. And overseas, we don't have those numbers. It can come from anywhere. So with the numbers that are coming in, the interest in medicine itself, how much does it make you stronger, and how much does it actually make you survive this? Because we a lot of when we had smaller numbers, we knew that we needed to do this to survive, and we needed to pass all the postings and all the hurdles that we had during housemanship, medical officership, and all that to become a good doctor. So now it's different. And because numbers have increased, another issue has been who wants to get the papers passed first. So who wants to get? So that's another issue as well that we need to look into. So if you ask me, yes, times have changed. If you ask me the question whether they are more thin-skinned or not, I think there are a lot of other factors that are actually contributing to this. And this includes the factors that I mentioned, like interest in medicine, social media. What do they really want? Are they really into medicine to help the patient there, or are they into medicine because parents maybe ask them to be joining medicine? And once you're already in medicine, are you chasing your papers, or are you chasing what you really chose to do? So I think these are important things that we need to look into. Maybe Dr. Ashok can comment as well.
Yeah, I suppose as a person who has children, I don't think that the younger people are really any more thin-skinned than we were. Yeah, because emotional abuse is emotional abuse. But where they differ, perhaps, is that they are not so afraid of speaking out as we were. Maybe our parents were sort of said, children should be seen, not heard, whereas we brought up our children to tell us, what you're feeling, what you're thinking. So now they do expect that what they say and what they think should be given some consideration. Whereas in our day, it was just, if I say something also, it's not going to make any difference. I better just shut up, take it. So now they expect that if their feelings are, if their feelings are injured in any way, they should be able to say so, and it should be taken seriously. And I agree, it should be listened to. They're not. I don't think they're more thin-skinned really. But like Vijay was saying, if you've got no real interest in medicine, then you're not going to take much nonsense. Whereas if you're really got a passion, you'll put up with a lot of stuff.
Yeah, I think the younger generation, in my impression, is that they tend to, be able to speak up in reaction to criticism better than maybe back in our day, where we were just, be a bit more subservient to that and then just keep quiet and shut up, But now people would speak up. Unfortunately, also people tend to vent using social media. So I think my advice is probably don't vent about your work in social media, because the internet never forgets. So if you are going to spew out use it as a means to vent your frustrations and all that, it's probably not a very good idea, because you might say things or write things in the heat of the moment which you might regret later. But people unfortunately still view it as a popular medium for tweeting out something or Facebook posting something. But be mindful, if it's in a public timeline, you never know who's going to read it, who is taking a screenshot of it, or maybe you have revealed some confidential info unintentionally even.
Yep. And you end up in front of an MMC.
Yeah, exactly. Yeah.
Anyway, everybody should read Dr. Alan Tay's article in the Berita MMA last month.
About social media, yeah. But if it's in the social media, maybe they would read it, but in the print, maybe they don't read it.
But everybody gets a soft copy of it. Everybody gets a soft copy.
Yeah, but it'll be good. So Haris says we do not support bullying, and this younger generation put their views in social media. System must be put in place to tackle it. Yeah.
Oh yeah. Okay. Yeah. True. Very true. And
just to add regarding the cyberbullying, we do have actually a you can check on r.age, the website. We do have an email where those who want to complain can even complain on cyber999@cybersecurity.my. So this I think this is something which is still new to a lot of us. In fact, even I probably knew it only about a few months back. But yeah, there is an avenue where people can complain about cyberbullying as well at cyber999@cybersecurity.my. So I think this is something that
999 help center.
Yes.
Is it?
Yes, correct.
I said cyber security. Okay. Cyber. I think if you go to, I'll just put up the link. So this is the cybersecurity.my. There is a Cyber 999 Help Center. So I was not aware of it.
So this is for online bullying.
For cyberbullying, yeah, correct. Yeah, because I think today people are all using social media, and bullying does not happen only at workplace, but when they come back home, some do post their ventilations, like you all mentioned earlier, and these ventilations can sometimes tag other people, and they may probably even not protect a patient's confidentiality at times. So I think all this can actually be, as long as we know what options we have and what policies are in place, I think that itself is a relief for one who's the recipient of the bully.
True. But what Dr. Haris says is correct. We have to be, you have to teach the younger people. They should know this. It should be instinctive almost for them, because they've been using social media for so long. But sometimes they fail to realize, you can't really visualize how quickly things can spread and get out of control. So especially when it comes to work, I think it's better not to put anything out there on social media. no matter how disguised, especially if it is, you're venting, you're getting angry. If it's just a humorous anecdote, yeah, go ahead, but still maintain confidentiality. But if you're angry, don't post. So I think a good guideline.
Take a deep breath. 10
Turn
deep
off your
breaths.
computer.
Yeah, or turn off the phone. Yeah. So I'll just put up the links again for help doc. Maybe the number is there. Maybe you should keep it in your phone. In matter of distress, I think you should call. How many volunteers do we have in help doc? Do we know at the moment?
At the moment, okay, usually commerce manages the main bulk of help doc, unless it has got something to do with the private sector. We do have secretariat at MMA offices as well. So it's basically a panel that is shared between this commerce committee and the panel at MMA HQ. Yes, at the moment we are managing in the sense that I think last week we got 3 or 4 cases, I can't remember, but most of it have been solved except for one in which we need extra information. So, but besides that, most of it within 2 weeks. Within 2 weeks, we have even had cases which are solved within 2 days. So yeah.
Okay. So that's in case people are not aware, the MMA is there for you. Okay, in terms of providing the help doc service if you're distressed. What about, there was a comment earlier in MMA Facebook, but are we going to talk about burnout? I said, does help doc help with burnt out doctors, junior or senior?
This is something that we are really looking into right now. Actually, for all those who are following us on this thing on Facebook, we just as the logo on the top right of the screen says MMA's Commerce. There's actually an MMA's Commerce FB page. In fact, we have just come up with the page about 2 weeks back. Prior to this, it was a group, but we made it a bit more open. We are sharing our information with any doctor who wants to go to see it now. You just have to type out MMS Commerce on Facebook, and you'll see it there. Now, speaking about burnout, we have just got our study registered regarding burnout in with NMRR, and we'll probably be pushing this study in the next 1 to 2 weeks, because so happened that we just organized a Kaji Salide of all healthcare workers in Malaysia in the Ministry of Health about a week ago. This involves 18 associations, which involves the nurses, the medical assistants, everyone. So since we just launched that study, the study about burnout, we are postponing to about 2 weeks later. But there will be a study fully done on burnout, which uses Copenhagen burnout inventory. And we have got the NMRR registration for that already. So that will be coming up soon. And for further updates, anyone who wants to check can just join our link of MMA and MMA's Commerce, and we can take it from there. I'll probably be sending you the link as well, Ellen, shortly, so that you can share it.
Sure.
Yeah.
I have the Facebook. It's a page, isn't it? The MMA Commerce page.
It's the page. The page would be easier for anyone to access, since it's open to anyone who wants to join. And probably we have daily updates on that, and anyone who wants to even share their thoughts with us, they can actually request for it to be posted, and we'll post it there as well.
Right. So I'll just share the.
In fact, the help doc poster and our statistics of the study that was done in 2018 was also all posted up regarding bullying and harassment. Yes.
Yeah.
So this is the page, is it?
Yeah.
Yes, correct. You see the poster on the left-hand side in the middle area. The yellow one is the help doc. This thing just a bit. Yes, correct. The yellow one.
Yeah.
Yes,
Okay.
that's exactly how help doc works on our side. So there's a flow chart there, and this is what happens. Yep.
Okay. All right. Okay, I think
Vijay,
yes.
Yes.
No, I just wanted to ask Vijay whether it's true that more and more of the housemen and MOs are seeking psychiatric help nowadays. During the
Yes. Well, I wouldn't only say MOs and house officers. I think some specialists also need some help, because I think we are being stretched, and at the same time, a lot of factors that we need to take into account, which is, for example, let's say your colleague is tested positive, for example. and you automatically get this anxiety that who knows, you might be positive as well. So that is one. It doesn't purely come from bullying and harassment alone, but the pandemic itself has caused a lot of stress. Has caused a lot of stress among doctors. We have heard cases of doctors even quitting. Some doctors even quitting or on the verge of quitting, which causes a heavier burden or heavier workload on some of the other colleagues, and this has caused their colleagues to probably develop psychological stress as well in a way. So yes, cases have increased, especially among doctors as well. And we do have, I think every government hospital has their own MHPSS team, which is the mental health psychosocial support team. And this team actually actively, we do have numbers posted at every hospital to contact, and the people can actually contact their hospital team for psychological support and counseling as well.
So without,
Yeah.
stigma.
Yes, without any stigma. We do have another problem, which is recently becoming an issue, which I think was also posted on newspapers, especially mentioned by our DG as well, regarding patients and public who are lying, who are dishonest about their symptoms. So this has caused a lot of distress, especially if they turn out to become positive. Now, in my own personal hospital, I've actually seen people who were like who were really really affected, and had issues with sleep and their I mean sleep and their mood swings and all that, purely because of these kind of patients. So while we speak about bullying and harassment amongst doctors, I think we also should remind the public not to distress our doctors at this time, especially during this COVID pandemic, because this is also a form of bullying and harassment, if you ask me, about being dishonest about symptoms, and this causes a lot of distress to doctors. So we need our doctors to be well, to make sure the patients are well as well. So I think this is something that we really need to look into.
Yeah, it's a good point that it's extremely stressful times for us all, both in public and private, with this pandemic. And I think, in departments also where your colleagues are quarantined or become positive, and then you're short staff, it makes things even worse, I think. Yeah, definitely. So I think we've coming up to almost an hour now. So I'd like to thank you guys. I think it was quite a comprehensive discussion about bullying, and I think we've highlighted the help you can receive from MMA in terms of help job, in terms of the CISPA, and also I learned something about the cybersecurity today if you get harassed. Yeah, so these are useful resources for everyone, not just junior doctors, but even more senior ones, especially if you're feeling very stressed out or burnt out or something. There are avenues for you to seek help. Any other last minute comments or otherwise? I think it's been very productive session. Thank you, Vijay and Ashok, for coming in last moment like this, but I think it's very topical, and it's good that at least we've highlighted this and discussed it openly. Yeah.
Thank you so much, Dr. Allen. And before I just sign out, I just want to remind, whoever's listening on the other side, whether you're a bully or whether you are the recipient of the bully, I think what's very important for us is to actually talk to others, polish up our communication skills, and also check on our local policies. Actually, on MOH website, they have actually got quite a good set of guidelines and system to follow. And this is mainly speaking about the government side. So check on our policies and all that. Yes, we are still pushing for a doctor guideline of bullying and harassment. We do have a doctor and patient one. We are pushing for a doctor and doctor one. But what we can do to help ourselves, the first and most important thing, I think, is probably talking to others, not to keep it under ourselves, and speaking to others, meaning not putting your propaganda up on social media, but get help from your friends, from your peers. We spoke about mentor-mentee system and all that. I think these are things that we should really look into as the first step before we go on further. And do remind ourselves that help is out there. It's whether we want to reach out for it or not.
Okay. All right.
Thank you, Alan.
So, yeah, I think we'll have to call it a night. It's almost an hour. Thank you all for your time, and thank you to all those listening. The videos are still there in our Facebook group, so they can watch later and maybe make the comments in the MMA Facebook group if you have further questions. We can try to address them. Okay. All right.
Okay.
So good night and have a good weekend, everybody. All right.
Okay. Good night,
Take
Dr.
care.
Alan, Dr. Ashok.
Yeah.
Good night.
Take
All
care.
right.
Okay. Thank you.